I don't want to confuse people, but actually, I think they were actually doing a slightly different session. It is equally as important. We're actually going to be looking at the end of academic silos and whether there's, in the breach of in the wake of COVID-19, greater opportunity for global health collaborations. I am Catherine Hood. I am a doctor by trade, but I'm delighted to be moderating this very interesting session and this very interesting topic as part of the health and wellbeing stream of CogX. So thank you very much for inviting me. Now, I'm also equally delighted to have two excellent speakers who are going to sort of guide us on how they feel COVID-19 has impacted on the academic silos and the way that we communicate. First of all, we have Ritu Dhand. Now, Ritu obtained a PhD in cancer research from UCL, and then she moved into the academic journal Nature, where she's worked for the last 21 years. She started as an editor and has now become the chief, then became the chief biological sciences at Nature, and now is the vice president of all the Nature journals, responsible for the overarching editorial strategy. So thank you very much, Ritu, for finding the time to join us today. We're also hopefully, I think I saw her popping in just as we started, we're hoping to also be joined by Nicole Mather. Now, Nicole Mather is got her doctorate in neuroscience at the University of Oxford, and then set up an office for life sciences in government, and now has roles at IBM, the Wellcome Sanger Centre, and the Health Research Authority. So she's going to also give us her views on this subject. So, without further ado, I'd like to hand over to Ritu. So Ritu, when we look at the end of academic silos and greater global health collaborations, what are your thoughts?
So, I mean, to start at the sort of the beginning, as it were, on how COVID has changed the way that we have communicated science and published science, the framework remains the same. You know, Nature supports and encourages preprint deposition, but during COVID, we were checking that preprints had been deposited, and if they hadn't, we were persuading authors to deposit a preprint. And we also had a service to upload preprints onto Research Square to support the authors. You know, another difference in the way that we've dealt with COVID-19 papers is normally the data behind the paper should be available for review if requested by the reviewers, and it needs to be deposited or made available at publication. But we are now asking authors to deposit the data before peer review starts so that everyone has access. You know, the timescales have changed so much. In COVID, you are reviewing for one round, essentially. It's either going to make it or it's not. In the normal research communication, we allow for extensive revisions. There is no sort of hard stop. You get one chance or nothing at all. The publication times have changed. You know, on COVID-19 papers, everything is a fast track. Everything comes out after acceptance within 2 weeks, sometimes less, a week, even a couple of days. Obviously, we cannot sustain that for all papers that are being published, and the normal time is slower with some fast track. We are publishing all our COVID papers free to access. And normally, someone somewhere has to pay, be it subscription, or the author pays for an open access. The editors have been put under a lot of pressure to deal with these papers very, very quickly. Every paper is urgent, you know, if it's sort of alerting to a new drug or vaccine or, you know, the disease phenotype, whereas, you know, editors are not under that kind of pressure for all papers. Yes, some papers, but certainly not all. And that's changed the way editorial has had to peer review these papers. But the scientists themselves have been working very, very differently. You know, science is meant to be collaborative, but the reality is that science is quite secretive. People work within their domains, their groups, in a closed environment. And yet in the COVID area, where we are seeing collaboration happen in front of our very eyes, the social media has played an absolutely tremendous part in sharing of information. All eyes are on one question. You know, we have biologists saying they're concerned about droplet infection from talking, and physical sciences are hearing this is a need, and they're looking at droplet transmission in a physical way and telling us exactly how far it will go and what the distance it will travel. That sort of coming together of different communities would normally take years, while one question, you know, the community makes a question known, and then someone collaborates, and then they work out that they can come together. Everyone can see everything at the same time. Everyone can see the problems. Everyone can see that the questions that need to be addressed. And so all the different communities, be they social, physical, even the earth sciences, are coming together and working on this at the same time. Preprint servers have successfully launched on the back of COVID-19. MedArchive was launched just before the COVID, so questions started to come in. And collectively with bioRxiv, there are now 5,000 papers on bioRxiv. You know, scientists are sharing papers on institutional webs, pages, and having, you know, sort of collaborative discussions going. And, you know, through those open discussions, people are becoming authors on the paper. The preprints are being summarized in real time by journalists, by other people that are just trying to help get the information out there. This has been amazing in terms of access, but of course it has its downsides, and some of this we'll discuss later on in the discussion. And I'll stop there to allow Catherine to carry on.
Lovely. Thank you very much, Ritu. It's very interesting. It all sounds very like there's been a lot of changes, but they all sound like they have potentially been very positive changes. Now, I think Nicole has joined us, and I know, Nicole, you haven't had a chance to test your mic, so now's your opportunity just to say hello. Are you with us?
Hi, can you hear me?
Yes, we can hear you, so that's all good. So, Nicole, maybe you'd like to give us your views of how things have changed in the respect of the silos and the way that people are working together from your perspective, from IBM, also the Wellcome Sanger Institute and the Health Research Authority.
Thank you. Yeah, I mean, I think from the point of view of the Sanger, there's been great global collaboration for a long time, from the Human Genome Project back in 1992 through to work happening now on the Human Cell Atlas and the Gates malaria work. So in genomics in particular, I think there has been excellent collaboration, but there's always an opportunity to do it better. And I think what's been great through COVID is that a much wider range of organisations have been driving collaboration. There's also been great commercial partnerships. So, for example, between GSK and Sanofi, and Pfizer and Fosun, and across commercial and academic boundaries, for example, AstraZeneca and Oxford. So there's been some fantastic new consortia as well through COVID. So the Open Safety Consortium, the CogX, and the Fraser Group at the Data Institute, who we've been working with as well. And so real steps forward on collaboration and real openness. And I think technology has played a fantastic part in this collaboration. So the use of online collaborative tools has enabled a far wider audience to participate, not just video conferences, but joint workspaces, so Health Data Research UK, for example, creating an ecosystem, and technology like GitHub, where everybody can post their code, and with working with the Fraser Group, we've had 4 or 5 different organisations contributing to the single model. So I think that the technology has been a real driver there. The IBM consortium as well, providing that compute for COVID, which UKRI has recently joined. So I think the alignment of incentives has really changed the way that people have behaved, the shift in risk appetite. But we need to make sure that we don't lose what we gain. We need to keep quality. We need to keep patient involvement. We need to keep data stewardship. And we should make sure that we keep our priorities right. So COVID has presented us with a fantastic opportunity to see what technology can enable us to do. but we do need to make sure that we keep the right things, and that we don't have a sort of more haste, less speed type effect.
Mm-hmm. Lovely, great. So it's very interesting. So you've come from very different perspectives, but it sounds like there have been great sort of major changes in the way that that people are communicating, and that they are that they are actually sharing data and sharing information and working collaboratively. We've got a bit of time now. We've got about sort of 10 minutes or so to really go over some of, maybe in greater depth, some of the issues that both of you have picked up on. The first thing I want to look at is this sense of global sort of collaboration? Well, actually, in terms of the silos, have the silos always been a problem, or are there things that we're losing as we move away from these silos? Are there any problems that are associated with this? I mean, were there any problems with the way that the silos were working? What were the main issues?
I think what the silos meant that there could be repetition, resources weren't used most effectively, things that are exciting, everybody's working on at the same time. It generates competition, and competition has its place, and it's a good thing. But perhaps the silos were too great. And you need to have a balance. You need to have the collaboration so that we can make the most of the resources that we have. Mm. And you need to have competition to ensure that people don't sort of rest on their laurels and sort of think, well, I'm the only one doing this, so it really doesn't matter how long it takes me to do this. So you do want a little bit of both. And I think as Nicole said, there are things that we have gained that we definitely don't want to lose, but that haste has also brought things that we don't necessarily want to take forward, and some of that might be there has been a deluge of papers submitted to journals all around the world in the space of 3 to 4 months, and unfortunately, a large proportion of those papers have been written very, very quickly. They perhaps, haven't been analysed in a way that is the most rigorous on behalf of the authors themselves. There is a lot of haste to get that information into public hands as quickly as possible. And there have been mistakes, at the level of what was submitted as a paper, at a level of what has then been published, both on the preprint and by the journal, and then what has been reported by the journalist, and this is information that everybody understands. Suddenly the research community is not this small; it's this big. Everybody's reading this, And so we do have a responsibility now, a much greater responsibility than perhaps before, where most people didn't know, 90% of what was being published. Now everybody knows and everyone's reading, and there is a bigger responsibility to get it right. But unfortunately, because of that haste and pace, we haven't always got it right.
Nicole, do you have any comments on that?
Yeah, I mean, I think it's really interesting if you're looking through coronavirus, there are some things which the rapid publication has allowed us to identify. So the Kawasaki disease, for example, the importance of cloning and stroke in people with middle age with coronavirus. And if those case studies hadn't have been published in lots of different places and we hadn't crowdsourced the problem, then perhaps nobody would have known about that and we wouldn't have been able to identify it. On the other hand, of course, there's the challenges that the Lancet has faced last week with publishing quickly and not being able to undertake the normal levels of due diligence on data. And I think it will be a real test of how many of the preprints actually make it into peer-reviewed publications. And, the question about how the peer review can be accelerated. I know there's been some of that to try and retain some quality. But also just not to lose those individual case studies, which You need to be presented in the right light so that people can evaluate them. But crowdsourcing in small numbers has been quite important, I think, in some cases.
Yeah, and even from sharing of data at the bedside, like you say, around Kawasaki's disease, which is obviously quite rare, it's been enabled to get research done on clinical research done on several cases, because that you can bring everyone together and increase your data set. But there is that question about quality and speed. And is that something you think the journalists are responding to? Or these the preprints? And is there a problem? Is there a challenge to the quality of data if it's too quick?
I think there were, before COVID-19, there was definitely a sense that preprints are the way forward. There wasn't any questioning of whether that was the right way forward. I think what COVID-19 has shown is that we need to be careful here, because preprints are open, they are accessible. There is a level of screening, but it's not a high level of screening. And if everyone can access and report on the preprint before it's been peer reviewed, there is a danger that science will be reported that hasn't even been peer reviewed, let alone been peer reviewed in haste, and then is incorrect. So, I think there are learnings, and no one is now saying that preprints are wrong, but we do need to try to manage that sort of publication process at the level of a preprint, to do a better job of highlighting how this is reported. I mean, journalists kind of did make more of an effort on the fly when, they were reporting preprints, and, people tended to forget in the early sort of stages that you have to say this has not been peer reviewed. But even if they say this has not been peer reviewed, does the lay person on the street understand what that means? There is a feeling that if a scientist has said something, has put something out, it must be correct. And so that's sort of bringing a deeper understanding to how science works, and no, it isn't at this point. Some more of that needs to happen if we truly want to go into an open research type of way of publishing.
I know you touched on the responsibility of publishers and journalists and people who are reporting on this, and I think we'll have more time to go into that, I think, in greater depth during the Q&A session, hopefully, because of time. But I also want to, Nicole, to get your views on how technology has been helping or hindering with this change.
Well, I think technology has been absolutely pivotal. I mean, it's not that much new technology has arisen in the last few months, but the volumes of people suddenly using video conferences, Slack, Jira, Trello, online whiteboard, and also GitHub. So the work we were doing, I was saying with the Fraser Group in Oxford, we've built a model together, but we've never met each other. And there's been 4 or 5 different groups across commercial, academia, and public sector building a model of the use of the contact tracing app. And it's, through the use of something like GitHub, which everybody can do, it can be completely open, it can be contributed to by lots of different organizations. And that can really help drive collaboration. So these collaboration tools are really being used in a completely different way than they have been before.
Yeah.
And another thing that technology has enabled is the high-performance computing consortium that IBM has supported. So that's the international consortium to the US and the UK governments, so the UKRI, as well as a lot of organizations in the US, and many technology organizations, IBM, AWS, and Microsoft. So all providing this compute so that a series of, I think now, over 60 projects to look at coronavirus can use all of this computing power to drive through to get some results. And I think we now have 20 molecules which we're thinking of collaborating with the lab to actually make and test. So really, again, crowdsourcing, bringing capabilities together in a way which is about collaboration, which is fantastic.
And there has been this great coming together, hasn't there? I think Ritu, you said that the eyes of the world are all on this one subject, and that has brought great benefit, which I'm hearing. We've got a few more minutes just on this part of the platform before we have to go into Q&A. So I really want to ask the question: is there anything we've lost? I mean, what are the dangers of this? I mean, it sounds like a lovely new world that's really collaborative, but are there pitfalls potentially, particularly around risk appetite? If we take a risk and try things out, and we're all being very experimental, but is there a downside?
Yeah, I think there is a downside to this this sort of publishing in haste. If the editor gets the paper, everything to do with COVID is important. And, observational studies, case studies, N is one, is something that Nature doesn't usually publish. But when N is one is being published all around the world, it might have impact. And, sort of that thinking of this is premature, but maybe this is really, really important, sort of conflicts with what would normally have happened. That editor wouldn't have felt this sort of, the pressure of the world to, sort of, is this report going to mean something to someone and I just don't know it? So that is different. I think from a researcher perspective, I think researchers should get more than one opportunity to see their work published. It shouldn't be a in or out scenario. Sometimes there are great ideas which can be developed into something better, or the data moves so that it sort of supports the actual paper. And that opportunity has not been there for those more careful authors who want to have more time.
Sorry to interrupt with you, because time is moving on as it always does. Nicole, do you have a very, very quick response? Do you agree with that? But then we need to go into the Q&A.
Yeah, so I think that quick thoughts for me. So I think what we need not to lose is patient involvement and a focus on getting our data stewardship right to ensure that we retain trust to really critical elements. And then finally, as we move from COVID to the future, priorities will change. COVID won't be our only priority, and I think we need to get a lot of public consultation about what our future priorities should be for streamlining, as we think about other indications, which are also, of course, extremely important.
Lovely. Thank you very much. Well, with that, we're just going to close this session. Thank you very much. For those of you who have priority passes, we're going to be carrying on our conversation in greater depth during the Q&A session. So do join us then. Otherwise, thank you very much to my speakers, and thank you very much for joining us.
Want access to more CogX videos? Subscribe now for free at cogx.co.